Audio recording for this meeting has begun.
Good afternoon, and thank you for joining us today for Keeping It Classy, Implementing Standards 5 through 8. Before we get into the presentation, I would like to cover a few details. First of all, please mute your phone lines. We weren't able to mute it on our end, so we would really appreciate it if you could mute yours manually. It will reduce the background noise greatly. We encourage all attendees to make use of the chat box to submit questions and to feel free to do so at any time. Your questions will be addressed as we go along or will be answered at the end of the presentation. This presentation features 2 videos, and with the recent changes that came along with the latest version of Adobe Connect, we're going to ask all attendees to manually click on the link in the presentation in order to be able to view the video. Our fantastic presenter, Alicia Gonzalez, is back with us today to continue our in-depth series on the culturally and linguistically appropriate services. All of these webinars will be recorded and available on the WYPCA website. However, we encourage everyone to attend these webinars live, if at all possible. Alicia is with the National Center for Farm Worker Health and is truly a subject matter expert on the CLAS standards and social determinants of health. Being present to ask questions and leverage that expertise is the best way to take full advantage of her knowledge on this topic. With that said, I'll hand it over to Alicia to get started. Thank you, Alicia.
Thank you so much. Again, thank you to the PCA there in Wyoming to organizing this second webinar, and I'm happy to have some of you back today. I recognize a couple of folks who are on that were also on the first, but I want to just confirm before I get started. If you can use your chat feature, if you can let me know if you were not on the first webinar, that would be great, because I want to make sure that I try to recap a little bit for those who were not on. So if you can just let me know if you were not on, that would be great. And if I don't get a response here in the next minute, I'll just assume that you all were all on the first webinar. And I'd just like to reiterate, at any time, I know this is quite a bit of information, which is why we had divided it up into 3 parts. Please feel free to ask a question during the presentation, because I think others may be able to benefit from the information as well. But I like to thank those of you who did send me emails following the last webinar with questions, and I'd be happy to do that as well until we get through the whole series. But let's go ahead and get started. For those of you who may not have been on the first webinar, I'm with the National Center for Farm Worker Health, and we're located in Texas, right outside the Austin area in Buda. And we work with the network of community and migrant health centers throughout the country, providing a variety of training and technical assistance services. And what we're talking about today around CLAS is just one of the many services that we offer to our health centers. And so we've been we're digging deep on each of these CLAS standards. As I mentioned in the first round, they can be, the way they're written can be complicated, or you see a lot of overlap between some of the standards. And it's really my goal to help you just understand them by giving you examples of strategies. There may be a lot more strategies than those that I mentioned, but I was mentioning those that I've seen are most common or that I've seen in the health centers that I've been working with. So as part of the recap, the first, as I mentioned, this is a 3-part series. We're on number 2, where we're going to be talking about communication and language assistance. And then next week we're going to have a different topic. But what we did on the first round is we talked about standards 1 through 4. 1 through 4, and we talked about governance, leadership, and workforce. So what are the things that we need to do at the top to really support the system where we are all pretty much singing the same tune? What are the infrastructures that we have in place at the board level? So, for example, policies and procedures. And then how do we prepare our leadership and our board to be informed around these federal requirements? And then how do we ensure that we hire the right staff and leadership that are going to be carrying out these activities, and how do we just maintain that and support that? And so we talked a lot about the importance of training at board level, but more importantly with staff. Staff are the ones who are engaging in patient care. They're communicating with patients on a daily basis. So how do we prepare them in a way that they feel confident in their ability to carry out the task, but more importantly, how do we ensure that we are culturally appropriate and that we are achieving the language competency standards that we need to in care. And I also would like to point out, for those of you who may have not had time to look at the resources that we have attached to this platform, I hope you've had time to now look at them if you were here on the first part. And I just want to point them out once again because I'll be referencing them. You had a health center assessment tool, which basically helps you look at where you're at in terms of achievement of these standards. We also provided a tool that gives you examples of strategies for each of these standards, and I've added some key concepts and words. Instead of trying to remember everything that's stated in a standard, through key concept and words, you're able to remember those a little bit better. And then I provided a implementation plan, and this is the document that I want everyone to have with them, because as we go through each of the standards, it's really to help you look at, okay, we're doing that, so we're currently meeting that standard, or we're not meeting it, and based on today's discussion, I think we could implement one or two of the strategies. And so it's really a guide for you to be able to carry out this way beyond these discussions that we're going to have. So again, that is the recap of the first section, and today we're going to be talking about the second theme. There are three themes, and we're going to talk about the second theme, which is around communication and language assistance. Now for these, to me, these are really, while they're all important, and as I mentioned in the first webinar, these are standards that are really here for you to support the work that I know that you're already doing to improve your healthcare delivery for the patient populations. For me, these are really the most critical, and these are really in line with the federal mandates that you have to improve access to services with persons with limited English proficiency, even more so for those that are receiving federal dollars. And so these become critical. And we're going to talk about each of these individually. So again, communication. Are we communicating to our patients not only in the language, in their preferred language, but is the information we're conveying, are they understanding it? So we're going to talk a little bit about health literacy during this next step, and I hope that as you walk away today, you really think about adding this as a training element to your already existing training, because if our staff are not able to recognize the clues or the cues that your patients are struggling, for example, filling out forms, then we can talk about how and what type of training is needed for that, because that becomes critical in this next theme. So I'm going to set the stage here by showing a real short clip that just demonstrates or helps us think about how important this is. So we're going to have to go ahead and click. I believe everyone is able to click the video, but I'm going to click it here, and hopefully I won't have any issues with it, but it is a YouTube video, and you'll have the link there. Here it goes. Okay, so hopefully everyone was able to view that video. Again, I think that it's very impactful. Every time I see it, it's of course this is really demonstrating when someone can't speak, the language. And as I mentioned earlier, it's not only about understanding the language, but are you able to understand the information? But very impactful video. I would just like to get some thoughts from you. If you were able to view it, if you can just use your chat feature, what comes to mind as you view the video? Any thoughts or impressions about it that you could share with us on the chat feature? I would encourage you to, again, there's the URL there, and try to integrate this. I know that for many of you who are on the phone, see this being played out quite a bit in your health centers. But for those of us who may not be as see it as much, I think this just serves as a really important reminder that for a lot of the patients we serve, perhaps they may walk away feeling a little scared. Perhaps this woman was really scared and just there was desperation in her voice because she wanted somebody to help her baby. And so just an important reminder to think that when someone can't understand or doesn't know the language, it can cause a lot of these fears and anxieties in us. So I just wanted to set the stage for this next dialogue that we're going to have, and we'll start with the standard 5, which is that you'll ask yourself, are you offering language assistance to individuals who have limited English proficiency and or communication needs at no cost to them to facilitate timely access to all health care? I think for the most part, all of the health centers that we work with, and again, this is just critical in providing health care, are providing some sort of language assistance. Perhaps it's being used through a variety of ways. A lot of health centers use language lines, for example, and a lot of health centers will utilize bilingual staff to be able to provide language assistance. But then the key here comes to timely access. I've worked with a lot of health centers that may have 1 or 2 bilingual staff that work in rural communities, and it's not always timely because they may be in another location and trying to get to the location where a bilingual provider is needed or an interpreter is needed. So again, I always suggest or recommend, and it is recommended that we think about utilization of certified, trained medical interpreters, and while that may be a challenge, at least for if you are using bilingual staff, it's really important that there is some way to ensure that the competency of the staff that's providing that service. So standard 5 is all about, are you actually offering that service to your patients? So you have to ask yourself in your organization, do you offer interpreter services for every non-English speaking client? Perhaps it's only for some, but then what do you do for those that may come in that are a smaller part of your population? Perhaps you're just using a language line. I was just in a health center recently that they're using a really sophisticated system where they have live, they log in and there's live interpreters that come out on a computer, and they're there to provide that interpreter services, which they just started it, and it's actually been working for them. So again, what works best for you in the area that you are in? Are you asking a set of standard questions in your registration process so that you're able to anticipate those needs? I'm pretty sure you are doing that using bilingual staff, and of course, how are you, facing those challenges that language access brings to the health center? So these are just things to think about as you offer these services. Again, it's all about, are they not only accessible but timely, and the use of qualified. So accessible possible, what do we mean by that? As you know, are we assessing the language needs at all points of entry, inform clients verbally and in writing of their right to an interpreter at no cost? Do we post signs informing the availability of services? Are we offering it at every point of contact? So the list goes on here, and I'll go to the last one, which I was just talking about. It's about consistently training your interpreters. For the most part, we find that we're using bilingual staff mostly than medical interpreters. We should never use our children as interpreters or family members. But again, if we are using bilingual staff, it's important to use tools or have those competency checklists available to help you ensure that they are interpreting medical information the most accurately way possible. And we, here at the National Center for Farm Worker Health, we're actually in the process of developing tools based on health center feedback that we've received that they would really like to receive more information about the bilingual competency checklists. And so we're in the process of finalizing some of those tools, and I encourage you to revisit our website so you can have access to those as well once they are up and ready. Okay, so here are some examples of those strategies to think about as you offer. Again, all your staff need to make sure that they're able to let patients know that you offer that assistance. And so they need to be trained on that, and that should be part of your policies and procedures. Another strategy is developing a process for identifying the language spoken, identifying the language an individual speaks. And so, you know, perhaps it's the use of a flashcard, or if you want the patient to identify what they speak, what they prefer, then they use a flashcard for that, and then you're able to add that information into the person's health record. Another strategy, of course, using qualified and trained interpreters. Establish contracts with an interpreter, another way to offer language assistance, which a lot of health centers use, especially because you're in, you know, remote areas or rural areas. So you have more timely access through a phone system. Using cultural brokers, we talked about this on the first webinar. It's having these champions, or for those of you who might have outreach workers, they really serve as a cultural broker to the patients you serve to help. That's going to impact care communication. So utilizing your cultural brokers to ensure that that language assistance is available to them is another strategy. And of course, providing resources on site to facilitate communication for individuals who experience impairment due to changing medical condition or status. So let's see, on your cheat sheet, the examples that I provided to you, there's some additional ones, a couple of more in that area to consider. How do you analyze language needs and average literacy levels of the patients in your service area? So are you doing some assessments, observations, or focus groups with existing and potential patients about the language services that you can offer in your health center? So to what extent do you do focus groups or interviews for potential clients? So that's an additional strategy. So let's move to number 6. So number 5 was offering it. So do you have that in place through staff or contracts? This is now, how do you inform all individuals that that is a service? So utilizing your cultural brokers becomes a good strategy, because they're letting patients know, hey, don't fear going into Health Center X. They have bilingual staff. They have people there that are going to be able to speak to you in your preferred language. So how do we offer that? And it needs to be clear, and it needs to be both, you know, written and also verbally. So in your organization, do you notify your patients? How do you do that? So you need to ask yourself now, okay, how are we doing that? Okay, is it posted on our website? You know, do we have it when they walk into the waiting room? You know, what are those standardized procedures for staff at every initial point of contact? So we have to think through that. Okay, so we have to think about what happens when they get to the front desk and the exam room, triage, and discharge. So just some food for thought there. So let's look at some specific strategies for that. Creating notifications that describe it. Perhaps when they call in to make an appointment, that question could be answered. Again, it may be on your website. It can be in, all over your center. Cultural mediator program, very, very similar to having the broker, the cultural broker, really promoting quality communication, and they act between the liaison. Again, that's another strategy there. Let me see any additional ones that we have. Posting signs regarding availability of free language interpretation, developing a process to determine a new client's preferred language during intake, and of course, creating a written policy that offers it at no cost. So as we think about all of these standards, as I mentioned on the first webinar, do we have a practice or a policy in place that supports that? So likewise with this issue with communication and language access. So let's look at the seventh standard here. Again, so do we offer it? How do we make it? How do we inform folks about it? But now we're talking about ensuring the competence of the individuals providing language assistance. So here again, there could be some overlapping. Earlier I talked about the importance of using trained or certified medical interpreters or the use of bilingual staff. So that's a strategy. But there's a whole standard here that looks at the competency, okay? Recognizing that the use of untrained individuals and or minors as interpreters should be avoided. So do you have them trained? How are you providing the training for your bilingual staff? And how do you conduct assessments on the quality of the interpretation service? As I just mentioned, these are some of the tools that we are working on to help health centers be able to do that in the most efficient, manner. I mean, are our supervisors, monitoring or observing the medical interpretation, and how are we keeping track of things that we should be improving upon, and how do we provide that feedback, but then how do we train that consistently across your whole center becomes important. So again, here's some of the strategies. Assessing the individual's language ability. There's this many options for testing an individual's ability to communicate in a foreign language. There are if you just Google the national interpretation or medical interpretation, you will find a lot of tools that will help you be able to assess their ability to provide that. Reminding yourself too, another strategy is perhaps testing or evaluating at the point of recruiting and hiring before you actually bring them on board, and if you know that that's going to be one of their responsibilities, doing that prior is another strategy. How are we employing a multifaceted model, providing a variety of assistance? So you might have a different models depending on what service site that you are at. And there are some organizations that actually give bonuses or incentives for staff to take medical interpreter training courses on their own time if they can't do it, obviously during regular hours, but there are staff incentives given for that as well. Standard 8. This is the last standard in this section around communication and language access, and this happens to be one of the topics that I enjoy talking a lot about, because I think that health centers are so busy, they're so challenged with time and not having the resources to be able to provide information that is in the literacy that is most that your patient populations understand. And so Standard 8, it's all about, and I want you to ask yourself, do you believe that you're providing easy to understand print and multimedia materials and signage in the languages commonly used by populations in the service area? And so, meeting the standard of providing information in the language. So for example, let's say Spanish. We can translate, and you're meeting the Spanish. You can have stuff up on your wall that's in Spanish, or you provide information that's in Spanish. But the key is, are they going to be able to act on the information that you're presenting to them? And are they going to be able to understand it? Becomes key. So we might be meeting the standard by providing it in Spanish, but can they understand it is what this standard is all about. And so if you think about some of the materials that you have currently in your health center, and you know what could be improved upon. And so that's what this whole section is about. It's about health literacy. So can they read, understand, and act on the information? Most of the time when you ask a patient, can you understand what I'm saying, most likely they're going to say yes. And so because of not, you know, the shame of telling someone that they may not know how to read, or they just don't want to understand, or why would I tell somebody that I respect, who's my authority, i.e. in this example, your physician, that I don't understand what they're saying. And so they need information that they're going to be able to act on and make good decisions about their health care, obtain and process and understand information. So it's complicated. And as you think about this topic of health literacy, when patients are sick, or when you think of yourself being sick and you go to your own provider for care, what is it that you want to get when you go see your provider? You want to feel better. You don't feel well. You know, you're not thinking clearly. You want to go in and out, get a prescription and go. And so during that exchange, because we feel so bad, we miss a lot of information. And a lot of the information, studies show that a lot of information that we receive, more than half of that information is recalled incorrectly. And so we have to, I like to think about using universal precautions. We need to assume that every patient that comes into our center is going to have difficulty understanding health information. And so it is complex. It's a lot. You're trying to teach them that they were diagnosed with diabetes, and now they have to change their diet, and now they have to check their blood on a regular basis and document it, their glucose. And so there's a whole list of things that they have to do, which can become very overwhelming. So how do we break that information up in little pieces where it becomes easier to kind of, you know, swallow, for lack of a better word? So this is the whole issue around health literacy. I'm going to show you another short video clip here that I wanted to show it to you for a couple of reasons. One is it sets the stage for how big of a problem this is, and sometimes we don't really think about it as being a big problem, but it is. But it comes from the American Medical Association. But for those of you who are on the phone who may have an interest in training staff and providers, or you may be instituting a new training program, I think this is an excellent video for providers and clinicians. This is like a 30-minute video, but this clip comes from, it's a YouTube clip that you can Google, and it's about 3 minutes long, and it just touches, it kind of just highlights the essence of this topic. So I'm going to play it now, and hopefully you'll be able to hear it.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read. Doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them? Motrin or Tylenol and Motrin, because that's what. How old is your daughter? She is 4. She's 4, okay. I would give her the 4 to 5. Take the temperature and
One capsule.
that's right. One capsule.
One capsule. Oh, that's twice daily.
Okay. So how would you take this?
When I see it's not on that tin, I had to take it. It said take it twice
hyper mean to you?
That's where you can't be still. You always gotta be doing something.
Do you think I think you're hyper? You have hypertension?
I don't know. That's what I considered
Okay.
it being, you know.
But you know you have high blood pressure.
Mm-hmm.
Okay. But hypertension doesn't mean the same to you.
Mm.
I have small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult for me to take these pills because if they say one tablet twice daily, I don't know if the doctor can take one in the morning, one in the evening, or take one in the afternoon or one in the evening. So usually what I do is take 2 of them in the morning, and this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and mostly, if you realize, the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. It scares you. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity. So I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
Any thoughts or impressions about this video clip? Again, I hope everyone was able to hear it and view it. Anything come to mind that you'd like to share using the chat feature? Again, this video, as I mentioned, I like to show it because it just really reminds us that it doesn't matter which walk of life or color of our skin or how much education we have. It impacts all of us because it's just complicated sometimes, and we have a lot going on that prevent us from really understanding what our providers are saying to us or our clinicians are saying to us. So thinking about what are some of those specific strategies that we can put in place to make sure that, one is that we create that shame-free environment where people can feel comfortable to say, hey, you know, I really don't understand this form. Can you help me? How do we help our staff be able to create that shame-free environment where patients don't feel like that? And so this is why we're talking about all of these practices, because we need to have them in place to support that and create that environment. But also, how can we also instill in our patients, you know, that it is a shared responsibility. How do we teach our patients that, you know, let's ask, when you go to the doctor, ask these questions, and it's okay to ask these questions. So how much patient education and information do we share with our patients before they come to the health center? Again, I'm gonna talk about utilizing promotoras or health promoters and outreach workers. They are the best source to help, you know, bridge those challenges between the community and to the health center. So as we think about, you know, the video showed us a lot around, you know, understanding medication. So that's one thing. Do we look at the way we write labels and And, sometimes labels have icons or these little images, and are they able to, if we use a lot of images in the materials that we provide to patients, we have to be very careful, because what's the saying of a picture says 1,000 words? I mean, but is it sending the right message? Is that one symbol or that picture, is it going to be interpreted the way that you intend? So that becomes critical as you look at, or I don't know if many of you on the phone are responsible for developing materials. There are some principles to keep in mind, and I'll go through some of them here in a little bit. But what should we be mindful of as we translate information? We know that the patient populations that are served by community health centers, typically about a 4th grade reading level, 4th to 6th grade, and that's what we should always aim in providing health information. So we have to look at our signs, our directions, notices about interpreter services, legal documents, consent forms. That woman on the video, Mrs. Cordell, that had the hysterectomy, she goes, I had 5 forms, and she signed everything because she was embarrassed to let somebody know that she couldn't read, and to think that she went back and they asked her, how do you feel after your hysterectomy? That to me just baffles my mind. How can we provide and ensure that even though it's complicated, what strategy do we put in place to make sure that, okay, so tell me what do you think is going to happen today during this visit or during this procedure? And it might take some time, but it prevents some of these things from happening. Our consent forms, client rights and responsibilities, our privacy notices, complaint forms, all of these things are educational materials. I know that it's hard to write this stuff, and we tend to find resources that may be available to us online on the website, or we just download. We might find some association that has X topic and we just use them, but we have to assess them. And are they written in a 4th to 6th grade reading level? A lot of the medical information that's out there is in a 10th or 12th grade reading level. So we have to take measures to write them in a different reading level. Here's just an example of a writing example, and I'd like to see what you think. If we read this, these slides are about just pregnancy care. So here's an example of something here written, and I want you to tell me what you think. It makes good sense that premature births and newborn illnesses are decreased by early pregnancy care. The doctor is actively involved in testing the pregnant woman for pregnancy-induced diabetes and a host of other problems that would not be detected by the patient alone. We know that these problems cause premature births and illnesses in newborns. It certainly makes sense that earlier detection and treatment of these problems by the doctor results in healthier babies. Is this a lot of information? Do you feel it's complicated? If you had to give it a grade, what do you think it is? You can use your chat. Okay. 12th grade? Someone said 12th. That's exactly correct. This is written in a 12th grade reading level. So you might take this and you might say, you might have a team of folks that work in your health center, and give it a shot, and let's try to reduce it some. So here's another stab at reducing it. If you are pregnant or think you may be pregnant, call for an appointment right away. Getting care early in your pregnancy will help you have a healthy pregnancy and a healthy baby. Your PCP will give you certain tests to make sure everything is going well. If there are any problems, it's good to find them early. That way you have the best chance for a healthy baby. Well, this sounds like it's a little easier, but if you had to pick a grade level, what do you think it would be written at? So the first one was the 12th grade. What do you think this one could be? I think it's somewhat easier. Any thoughts? You can use your chat feature. Okay. Someone said 8th grade. Actually, that's correct. And so, and I don't know if you know this, for those of you who might want to, test, just using your Office, your Microsoft Office, there is something on your toolbar, some tab on your toolbar that will it'll give you what the statistic is for that writing sample. It's not always accurate, but it kind of gives you a guide to be able to do that. And then the last example I'll show you, which it's written in the 4th grade level. Oh, I wanted to go back here to the 8th grade one. You know, using acronyms, it's a no-no. Not everyone would know what an acronym is, but it's really about also are we writing things in a active voice as opposed to a passive voice. So active, are they able to act on that information? Is it clear and concise as opposed to saying something like, ensure, you know, take X amount of tablets, 2 tablets twice daily. That becomes very passive. When do you want them to take that tablet or that pill is when you convert it to an active voice, where you should take 2 pills, one by 10 a.m. and one at 2 p.m. Here's the 3rd example. This one is written at a 4th grade reading level. This is where we should be writing at. If you are pregnant or think you might be, go to the doctor as soon as you can. Again, real specific and real clear with the actions. I won't read it all, but you can just see here that it's very active as opposed to passive in its text. So I just wanted to show you that, for example, and to think about, go back and think about some of the materials that you're giving to patients. And is the information short and simple? And am I limiting medical jargon? For us internally, we know acronyms and we know things that are used in the healthcare world and that translates onto paper, and that may not be understood by the patient. So limiting medical jargon, using those clear headings and bullets, lots of white space. We don't want to give some paper to someone that has just a lot of words and not a lot of white space because A, they may not be able to read it because the font is too small, but it becomes very overwhelming and they may skim through it, therefore they miss a lot of critical information. Using active voice. Really important here, focusing only on 1 to 3 key points. I always like to mention, you know, when we see patients, for example, diabetes or think of even cancer patients, we feel like we need to give them all the information because A, they may not come back. You know, what if they're a migratory patient and now they're leaving my community and going somewhere else and I don't know if they're going to come back. So we want to make sure they have everything they need to know about diabetes, or they have to have everything they need to know about cancer. And in that information, it becomes very overwhelming because we're talking about, you know, how likely X person is able to get this condition, how many people will get it, how many people can die from it. We tend to give a lot of that information that's, it's good to know, but is it critical for a patient to know if you want them to change their behavior? And that's the most hardest part of all this information around, let's say we're talking about breast cancer and what's the action. If they may be at risk of breast cancer, well, the action is we want them to get mammography screening. And so how do I give them written information that talks about, one is where can I get it and what's the cost of getting that exam? So cost and where to go are those things that will help a person act on the health information as opposed to giving them a lot of information that's just going to overwhelm them. And so we should always aim for a 4th to 6th grade reading level in the things that we provide. So here are these strategies. I've talked about some of those strategies already, but just to reiterate, creating documents in plain language. That's another term that we use in the health literacy world, plain language. So how would you want to write something to a patient that then you can kind of envision them going back home and telling a loved one or a family member exactly what you told them that they had. So that's what we mean by plain language. And again, it's very challenging to do. Creating forms that are easy to fill out. Registration forms tend to have a lot of acknowledgement statements. They tend to have acronyms. They have information about insurance. So again, is it active? Are you asking exactly what you need from them in a way that they can understand? Another strategy here is training staff to develop your own easy-to-understand materials and establish processes for evaluating them. Now, this is probably a strategy that many health centers don't employ because of the limitations. I mean, you don't have a lot of time to do it. It is a lengthy, it's a lengthy process. But for health centers who have class committees, we talked about this in the first webinar. That's a way to institutionalize this information or class as an important process or an important part of a health center operation. Those class committees, if you have them, are typically assigned to assessing all of your information and ensuring that they are written in the language that is going to be understood. Let's see, other strategies, translating materials into languages other than English. And now it's not good enough just to translate it. You need to make sure that the translation is accurate and that it keeps the meaning of what the intended message is. Developing materials in alternative formats for individuals with communication needs. A lot of providers might use visuals, again, because to avoid all the reading. So what are these, models, these things you can use or visuals? The use of little video clips. We see a lot of times providers use video clips to demonstrate, a topic or to talk about a certain topic with patients that become effective. So think about those. And more importantly, testing materials with your target audience. We're not going to know if people don't understand them unless we test them. So the use of, doing that through focus groups or interviews, that's an important strategy that I hope that you would consider. Okay, I'm going to stop. That was the last of the strategies. That was number 8. Again, all about communication and language access. There are more strategies that were listed on your cheat sheet that we created for you as a resource. I will stop now and see if anyone has any thoughts or comments or questions. Perhaps you might have a strategy that you're currently implementing or something that you've been doing all along for any of these standards that we talked about. I'd love to hear anything that you might want to share with the rest of the group. I believe we have a few comments that are coming in here. We will be, I believe someone's just asking about the slides that we have available, and I believe someone is, Kathy, I think you're responding to that question. I believe that they are available to you on the platform. Yeah, they're going to be made available on the Wyoming Primary Care Association website. And again, as I mentioned earlier, if you you have a thought later or you have a question, feel free to email me. I'd be happy to answer questions. I answered a few from last week. I just wanted to remind you again, we have our 3rd part webinar next Wednesday, same time on the 18th. And not only will I be reviewing the last section of the standards, but I would like to pick your brain a little bit on training that we are planning to provide to you. For those of you who are attending the annual conference in Wyoming, I really would like to tailor it to fit your needs. I know we talked a lot about different topics here, from cultural competency to health literacy to language access. I'd like to pick your brains on getting some specifics on topics that you would like to see in terms of training for the annual meeting that's coming up in May. So if there are no other questions or comments, that pretty much ends our webinar for today. Thank you again for your attendance.
Excuse me, Alicia?
Uh-huh.
I just had a few questions on my end, if you don't mind.
Who's speaking?
This is Hannah Wicki at the Wyoming Primary Care Association.
Yes, Hannah. Uh-huh.
Yeah, sorry. So I just wanted to know, what are some of the risks of using bilingual staff as interpreters that aren't trained?
Well, it's not that it's a risk. I mean, I think that's the reality of working in health centers, and I'm happy to see that more and more leaders are hiring bilingual staff because they recognize it's a need. I mean, our populations are growing and they're changing, and the need for bilingual staff is becoming greater. And so that is just a reality of the circles we work in, and that is fine, and that should be done more so than using family members or friends. And so a strategy to improve upon that is just making sure that your bilingual staff are interpreting the right way. That's just a quality assurance measure. And so that's just a recommendation. If you're going to use bilingual staff, how are you going to ensure that that is being done accurately, which is why there's a lot of tools and there's assessments that are out there that staff can think about. And so, of course, when you hire people as well, you want to find out how much, have they interpreted before, how long, and what were some challenges they faced. And so you just want to make sure that you're hiring the most competent person as possible, or providing them with the right tools and resources so that they can succeed. But that is just the reality. We are using bilingual staff, and it's just our goal is to prepare them as much as possible and give feedback as much as possible.
And then I just had one more. You had mentioned previously that there are some tools available for language assessment in terms of like when you're looking at hiring some bilingual staff and you want to assess their level or their proficiency within that language. What were they again, and are they available free of charge?
Well, there are some. I can send one or two resources that I know about. I was referencing also here at the National Center for Farm Worker Health, we get quite a bit of feedback from health centers that need these types of tools, and we're actually creating some tools now that are not quite available yet, but I'd be happy to share one or two resources of things that people can kind of start looking at and get them started, and they can come back and visit our website to get the ones that we're actually designing, which would be more health center specific. But I can send you a link, Hannah, with that assessment that I was referencing.
That'd be fantastic. Thank you so much.
Oh, you're welcome. You're welcome. Well, thank you again for everyone on today, and I look forward to being with you again next Wednesday. Thank you.